Hello, my name is Dr. Rod Fields. I am an optometrist, and I work on the Mississippi Gulf Coast as well as other locations throughout the state of Mississippi. Just to give you a little background on myself, I've been practicing for about 50 years. So I was in private practice, and for the first 35 or 40 years of that practice, I worked with special populations. And by that I mean I worked with children and adults who had vision problems that regular eyeglasses don't take care of. For instance, crossed eyes and lazy eyes and vision-related learning problems. So it evolved to where I actually set up a freestanding clinic outside of my primary care practice. And I had several therapists, and we did testing and training for people with special vision problems. So what we're going to do today is we're going to talk to you about some of the most common things that I've seen and that I've worked with clinically. And I hope it's fulfilling for you. I hope you get something out of this. So you've got some notes there that I think they're going to show the PowerPoint. And oh, dumb me, I walked out of my home this morning and I left all my stuff at the house. So fortunately, they brought them here for me. So we're going to kind of use the notes as a prompt for you guys. Okay, so there's millions of head trauma cases a year. We don't have to go over all the stats. Here's one of the things you need to know. I can't tell you how many patients that I have seen who come to me and they said, I fell on my head, or I had a head injury. I went to the hospital. I got an MRI, I got a CAT scan, and they said everything was fine. But their symptoms are classic brain injury. So a lot of these cases, they're not picked up. Not because the doctor missed it, it's just it's not enough trauma there for them to actually see it on a CAT scan or an MRI. So I've had hundreds of patients tell me, I feel like I've had a brain injury, and their symptoms correlate with the brain injury, but just because it was never picked up doesn't mean you don't have one. So I'm just throwing that out. Okay, so 75% of patients who have head trauma are in need of some form of rehabilitation. I'm going to say 75 to 85% of patients who have TBI, head trauma, also have vision problems, maybe even higher. The estimates run anywhere from 35%, I think, up to 85%. But almost all of them initially have a vision problem. Now, sometimes they have a residual problem, but a lot of the problems that they have the first few weeks go away. So I usually see them a few weeks after the trauma, and then I'll see them subsequently 2, 3, 4 months after that. But because a lot of the problems do go away. All right. So here's some of the components of the vision system that are affected. Number one, visual acuity. This is actually how I got into low vision, was that their clarity was gone. They had 2100 acuity in each eye after the brain injury. Well, what do you do with that when you go into a regular office and you want to be prescribed glasses and you can't get them seeing better than 2100? So a lot of patients do have serious trauma to the acuity section of the brain. That's back here. Ocular motility, the ability for eyes to move left and right, up and down, and locate a target. You'll see, what we see in brain injury is that these people have a lot of trouble following a target, and their eyes will jerk when they're following a target. Very, very common. One of the most common problems that we have is in binocularity, or the ability for them to use two eyes together. So you've got 3 nerve palsies. You've got 12 cranial nerves. Well, 3 of these nerves actually will cause, if you knock the nerve out, it will cause you to have double vision. One eye goes up and one eye goes down. One eye goes in or one eye goes out. And so and then you'll have all other anomalies, like the lid will droop all the way down. It'll close completely. You'll have paralysis of the muscle. So the eye, your one eye looks straight ahead and the other eye looks way out like this. Now these are tough problems to fix, for sure. So you'll have these cranial nerve palsies that creates double vision. Now, that can be helped. We can help by using glasses with prisms in them to eliminate the double vision, and or using vision therapy along with prismatic eyeglasses to alleviate the double vision. Accommodation means focusing. Practically every traumatic brain injury I've ever seen, their ability to focus up close with the glasses that they had yesterday is knocked down. It's not as good as it was. They'll complain. I just can't keep things clear anymore. Visual fields. Probably the worst thing that can happen visually is what's called homonymous hemianopsia. I see a ton of this. What it is if you have trauma to the right side of the brain, then many patients will have a left visual field defect in each eye. So in the left eye, the temporal field is cut out, and in the right eye, the temporal field is cut out. So basically, when they look at someone, they see only half of the individual because the whole left side or the whole right side is gone. Then along with that, we've got this thing called neglect. So neglect means when they have this happen, to them, this is hard for us to understand. To them, it's like there isn't anything there. In other words, I'll have them track. I'll say, here, follow my finger. And they'll go like this, and I watch my eyes. They'll go like this. And when I get into the blind field, it's like I said, where is my finger? They won't even know where it is. So I'll start again. I'll say, okay, now follow my finger. And I go like this, and the eyes just go straight. So this is very, very common. And when they have neglect, they neglect that area. They neglect it personally, they neglect it parapersonally and extrapersonally. That means that sometimes they'll put on a sweater or a shirt and they won't put their arm through the one side of the shirt. These people will shave half their face. The men will. They'll eat half of their plate. Yeah, they'll eat on, and this is, it's like we're going, dang, how can you not? It's hard for us to understand how that actually evolves. Now, there's therapy for that, and usually after a year or so, they do real well. However, I do prescribe a lot of glasses. They're called SVAG, Side Vision Awareness Glasses. And what we do is we take a pair of regular glasses, prescription, and we test them to see if I can give them prisms that will make what's on the blind field appear before them straight ahead. And so I test different strengths of prisms, and I also have to be knowledgeable of their cognitive ability, because if they've got a lot of cognitive deficits, then these glasses don't work as well. But I prescribe quite a few of these glasses to help individuals get around in the real world. Now, one of the questions you're probably going to ask, especially the men, is, well, can I still drive when I have a field cut like that? And the answer is no, you can't. I've had multiple patients tell me, they said, Dr. Fields, I'm going to drive anyway. I said, well, you go right ahead, but I'm just telling you that it's going to happen to you. So this is the one deficit visually from a TBI that I just don't want you doing, is driving with that field cut like that. Half of your field is gone, and I don't care how well you think you see, it just doesn't work, and eventually you're going to end up wrecking and hurting somebody, yourself and probably someone else. Okay, so post-traumatic vision syndrome. Again, I'm used to this because I see a lot of these patients coming in, but let's go over these characteristics. Exotropia or exophoria. That means that my eyes don't want to necessarily converge well. Like when I look straight ahead, my eyes are parallel. But when I look like this and converge my eyes, both of my eyes are pointing on my finger right now. But a lot of times, their eyes don't want to point there. Their eyes want to point way back here together. So they have double vision. So that's very, very, very common. We see this quite frequently. Again, prismatic eyeglasses can help that as well as therapy. And a lot of times, these characteristics do resolve on their own. Accommodative dysfunction. They can't see because it's out of focus. That's easy to take care of with eyeglasses. Convergence insufficiency, just where I showed you when I look at my finger like this and my eyes point together, then I see single. But if my eyes don't point together and my eyes point like back here, I see double. So the words will run together like this and overlap. And this is very, very frequent with these patients, very frequent. They'll stare. They'll have a very low blink rate. Like on a computer, when just anyone, not TBI, but just any individual, when we're working on computers, our eyes, we tend to blink a lot less because we're concentrating. And these folks just have a normal low blink rate. So a lot of them suffer with dry eyes because they're not blinking and moving the tears all around their eyes. They get very disoriented in space. So very, very common. They have difficulty shifting their eyes from one location to the other location and locating it, especially if they have a visual field deficit like I was talking about. The whole right side's gone or the whole left side's gone. These people, I mean, they literally have so much trouble navigating. They'll bump into things on that blind side all the time. So what I try to do is I try to give them glasses that will enable them to see what's in that side, but I also give them some techniques that we use to help them in the real world by just a simple head turn to the side of the blind field opens up the field out in front of them. And I tell them, what you want to do is, here's what they'll do. They'll be walking and they'll see something just a little bit outside of they'll spot it inside the blind spot. But they miss the car. They only go a little ways. You know, what I want them to do is I say, throw your eyes way out and then fixate back in, scan back in. Throw your eyes way out and scan back in. And by doing that, they don't miss the fire hydrant. You know, they got the sidewalk, but they missed the fire hydrant. So this is very, very important. And it's just simple little techniques that help these people. Now, here's one thing, one of the questions I always ask. Ambient vision is this vision out here on the side. It's peripheral vision. This is our survival vision out here. The center vision, this is for learning. This is for cognitive stuff. The side vision is for survival. Somebody shoots an arrow at you, you want to be able to see it out of the side of your vision and get out of the way. These people will report, I said, when you go into a grocery store, are you bothered by all the commotion? And almost invariably, they'll say, oh my goodness gracious, it's terrible. It bothers me a whole lot. I can't stand the commotion. There's just too much activity in there for those people. That's easy to take care of. And we can do it with their regular glasses by just taking some tape and putting some, what we call binasal occlusion on them. I can't tell you how many hundreds of patients I've taken. They walked in and I did a simple little test on them, put some tape on their glasses, and they walked out and they were so much better. So this unstable side vision is a real problem with these patients. Moving right along here. Okay, so blurred vision, double vision, light sensitivity. Boy, that's a big one. Some of them are extremely light sensitive. I have to prescribe really, really strong, dark tints for these individuals. Poor concentration, and objects appear to move. All these things happen with these people. That's why it's so hard for the regular optometrist or regular ophthalmologist who doesn't work with these people a lot. They just don't understand how this all comes about and how you work with it. Therapy, rehabilitative therapy with occupational therapists, with optometrists who do vision therapy. Unfortunately, I was the last one on the coast to do vision therapy here. We're trying to talk a vision therapist from Hattiesburg and coming down here. But right now, there is a clinic in Hattiesburg that works with brain injured people from a vision standpoint. It's called Bellevue, and they do a great job. So I believe that's about all I wanted to go over. Post-traumatic vision syndrome, it's real. I see it, practically every patient that I ever examine has post-traumatic vision syndrome to one degree or another. It's usually glasses will take care of it, prescribed correctly, and so will therapy. I believe that's about all. I hope this helps you. Thank you so much for paying attention, and Good luck with it.